Welcome to another Strive Sessions. My name is Joey Elkins. I'm one of the clinical pharmacists here at Strive Pharmacy. And today I'm excited to talk to you about a topic that I'm very passionate about, which is men's health. All right, quick agenda for today. We're going to talk about men's health in general, but we'll cover a few different topics, including testosterone, of course. We'll talk about endogenous versus exogenous testosterone. We'll also talk about healthy muscle and different medications that we can use to help grow and promote muscle. We'll talk about sexual wellness, and we're going to touch also on brain and mitochondrial health. So this presentation is for educational and informational purposes only and is not intended as medical advice, diagnosis, or treatment. These statements have not been evaluated by the Food and Drug Administration. Strive's compounded products are not approved to diagnose, treat, cure, or prevent any disease. The information shared is based on current literature and clinical experience, but individual patient care should always be guided by qualified healthcare professionals. Okay, first and foremost, of course, we're going to talk about testosterone. Testosterone is so important in many aspects of our lives. I want to first approach the topic by trying to address the stigma directly with testosterone. A lot of times when we talk about testosterone, we get switched over to steroids or rage or different things like that. But as providers, if we can first address the stigma with our patients, we can make an environment where they feel comfortable talking to you about testosterone, about their problems that they're having. So let's normalize talking about it. So whether you treat hormones or not, you should be asking the questions to your patients. So you should be asking them how they're feeling, how their libido is, how their confidence is. Answers to these questions can raise red flags. And like I said, whether you treat hormones or not, you can be the source that refers them out to get their hormones treated because you are the one in the room with them. You're the one talking with them one-on-one. So as we go through this presentation, my message is not everyone needs testosterone. My message is that if your levels are low and your life is shrinking because of it, you deserve an honest, evidence-based conversation about whether treatment might help. So testosterone is used in a number of different pathways in the body. As we know, it is a hormone primarily produced in the testes in the males and in smaller amounts in the ovaries for females. Today, we're going to focus on male health. And so we'll focus on male testosterone production and how we can optimize our testosterone production. So what's changed recently? Back in February of 2025, the FDA removed the black box warning on testosterone, which is a great improvement. That does not mean testosterone should be treated with any less respect. So as they did remove the black label warning, they also strengthened and changed, added a little bit more to the warnings about increase in possible blood pressure and cardiac conditions. So as I mentioned before, testosterone is still a controlled medication. We need to know what we're doing while we're prescribing testosterone. Testosterone levels in men are decreasing at a rapid pace, and it's happening at younger and younger ages. The causes of this are multifactorial. It could be a mix of stress, of poor sleep. It could be nutrients. It could be hormone disruptors. So whether it's our detergent or our deodorant, whether it's our skinny jeans that we're wearing, there's a number of different reasons that we could have low testosterone. But the fact is that it is happening, and it's happening too often. All right, so let's define testosterone deficiency. It's a mix of symptoms and lab values, right? So your patients can come in, they can talk to you about low libido, they could talk about decreased sexual desire, erectile dysfunction, a number of different things related to sexual wellness. But it can also be things like decreased confidence, brain fog, poor sleep. Those are all signs that there is a problem with testosterone. So if we compare symptoms with lab values, then we can properly diagnose testosterone deficiencies. So we talked about the range of testosterone. Usually the normal range is 300 to 900. I want to make sure we get out of the habit of thinking normal and we start thinking optimal with testosterone. Because yes, 300, 400 is a normal range. That does not mean that it is optimal for your patients. So these are the AUA guidelines that talk about the testosterone deficiencies, talk about the ranges that they're using. But again, let's focus on optimal levels and not normal levels. Okay, so let's diagnose two different types of hypogonadism. There's primary hypogonadism and secondary hypogonadism. And it's important that we can distinguish the two because then we can determine what treatment is best for our patients. When we talk about primary hypogonadism, that's testicular failure. So oftentimes when you draw labs, these patients will have low testosterone, free in total, but they'll have high LH and FSH. So that means the body, the negative feedback loop is working, except for when it gets to the testes, it's not producing. So that's primary hypogonadism. Secondary hypogonadism works a little bit differently. So this is where we have low testosterone, but we also have low LH and FSH. So the problem is happening upstream. So if we look at this chart here, we can see that from the hypothalamus to the anterior pituitary, that's where GnRH is released. That will then cause LH and FSH to be released down to the testes, where we'll produce testosterone and estradiol. So if the problem is upstream, if the LH is low, if the FSH is low, which in turn makes the testosterone low, then we're talking about secondary hypogonadism. And we can treat that relatively easily. So we can encourage the body to endogenously make more testosterone through influencing this negative feedback loop. So the negative feedback loop, if we think of it as kind of a thermostat in the room, when it's hot, the AC kicks on. When it's cold, the heater kicks on. The body works very similarly. So it wants to stay in a balance throughout its life. So if a hormone or something in the body gets too high or too low, the body has a mechanism to regulate it, to bring it back to normal balances. Now let's talk about endogenous testosterone versus exogenous testosterone and how we can influence those. So if we talk about endogenous testosterone, we mean the testosterone that the body naturally produces. And there's different ways that we can influence that pathway, that negative feedback loop. If we're talking about exogenous testosterone, it's testosterone that we're introducing to our body, whether it's via injections or creams or troches or capsules. So there's different ways we can treat with testosterone, with or without testosterone. So when is it best to promote endogenous testosterone production? If you have younger males who are concerned about their fertility, then it's a better idea to work with endogenous testosterone production. We influence how the body reacts. We can increase LH and FSH numbers. So that in turn can maintain fertility. If we're dealing with primary hypogonadism, then usually we need exogenous testosterone to treat that. We need an outside source of testosterone because our body's not producing as it should be. All right, let's dive into exogenous testosterone formulations and what we have available. The most common product for testosterone is injectable testosterone. So it's a testosterone that comes in a cypionate or an enanthanate oil. It can come in different carriers, vehicles or carriers, including cottonseed, grapeseed, MCT oil. We love to work with MCT oil because it's less viscous. And so with that lower viscosity, you can inject sub-Q or IM. Other ways to get testosterone into the body is transdermal creams. So we can do creams or gels where you would apply to a thin skin area and let it get absorbed. So many different ways that we can get testosterone into the body. It's important that you figure out what works best for your patient. So if they don't mind needles, usually injections is the way to go. We can do biweekly injections. We can do every other day injections. And especially with the sub-Q option, it's much less of a hassle. You use a much smaller needle for injections. But if your patients hate injections, we can go creams, we can go gels. So those are nice because you're not touching a needle. They're less invasive. The problem is it is something you have to apply every day. So it can be transferred as well. So be careful if you're applying it that you don't hold a pet or a baby and you don't shower immediately after because we need time for it to absorb. There are other options, including oral options. With oral options, you do want to be careful because testosterone can be harmful to the liver. So we want to make sure that we avoid that first pass metabolism. All right, so we talked about exogenous testosterone. That's where we're introducing testosterone to the body. Now we're going to go back to that endogenous pathway where we can influence the negative feedback loop. One of the most used medications is what is called a SERM, S-E-R-M, and that stands for Selective Estrogen Receptor Modulator. So how a SERM works in a male body is that it tells my body, kind of tricks my body into saying that I'm low on estrogen. If my body thinks I'm low on estrogen, it'll then in turn kick in that negative feedback loop to make more testosterone, to make more estrogen. So that's how we're getting an increase in estrogen levels. You might have heard of Clomiphene or Clomid. Clomid is the brand name of Clomiphene. Clomid is an FDA-approved medication for females to help them ovulate. So it works by creating an LH surge. So they get the LH surge and then they'll then ovulate and help them with pregnancy. So in the same kind of idea with males, it's going to cause an increase in LH and cause an increase in testosterone production. So I want to point out the difference between Clomiphene and Enclomiphene. Those are two different SERMs, two different selective estrogen receptor modulators. The only difference is Clomiphene breaks down into two different racemic mixtures. So you can see here that Clomiphene is a mix of Enclomiphene and Zooclomiphene. Enclomiphene is kind of the pure version of the SERM that we want. Zooclomiphene comes with a lot of estrogenic side effects. So if we can pull out that Clomiphene, we can get Enclomiphene by itself. So you'll see two different options when prescribing SERMs. You'll see Clomiphene and you'll see Enclomiphene. Just recognize they both come from Clomiphene. It's just Enclomiphene is kind of that purer version without the Clomiphene involved. They both still come with their side effects. They both can cause an increase in estrogen, but the Enclomiphene tends to have fewer side effects with it. Now, just like any other medication, we want to talk about the warnings and the precautions with these. Some side effects that you might see with your patients are headaches. There could be mood changes. There could be visual disturbances. Sometimes patients get kind of floaters in their eyes. That's not common, but that's a side effect of Clomiphene or Enclomiphene. And last but not least, you can get elevated estrogen levels. So as we're tricking our body, saying we're low on estrogen, but we're not really low on estrogen, that's going to cause an increase in testosterone. And anytime we increase testosterone, we can also increase estrogen levels. So just recognize when you pull labs for patients on Enclomiphene or on a SERM, that you're also checking estrogen levels. So we're trying to prevent that estrogen from getting too high. All right, one of my favorite products here at Strive is what we call Elevate T. Elevate T is 4 simple ingredients. It has that Enclomiphene that we just talked about. It has DHEA, it has pregnenolone, it has zinc. So those other 3 options are building blocks that the body needs to naturally produce testosterone. Again, we're talking about endogenous testosterone production. So we have 25 milligrams of each, and this is a great way to give your body the tools it needs to really make testosterone at a good optimal level. One important note I want to make about Elevate T is that it's a simple capsule. So a lot of times when patients come in for testosterone checks, they're worried about using a needle. This is a great option if they don't want to touch needles at all. This is also a great option for younger males who are not quite ready to get on TRT because they're worried about their fertility. They're still in the stages of having families. Elevate T is a fantastic option. One important note is how this should be taken. So I talked about those estrogenic side effects. We want to be careful that we're not dependent on the medication. So when taking this, it's prescribed 5 days on, 2 days off. So a simple way to prescribe it, you tell your patients you take 1 capsule before bed, Monday through Friday, and don't take anything Saturday, Sunday. So that helps the body give itself a little bit of a break to produce on its own and also let the estrogen come down a little bit if it's getting too high. Okay, a few products I want to touch on, products and modalities that I want to touch on with testosterone support. First and foremost is sleep. There is no better medication for testosterone, for endogenous testosterone production, than a good night's sleep. That is when the body naturally produces testosterone. So if we can practice good sleep hygiene, whether that's sleeping in a cold, dark room or minimizing screen time before bed, that can have a huge impact on how our body naturally produces testosterone. Other options that you'll see throughout this slide are different medications or different supplements that you can take to improve testosterone production. One of those being DHEA or 7-keto DHEA, 2 different options there. 7-keto DHEA has a little bit more of a metabolism thermogenesis effect than regular DHEA itself. But you'll know DHEA is a building block of testosterone. The body needs DHEA to produce testosterone. Other options are boron. Boron is a very important mineral for testosterone production. It can help minimize the SHBG, your sex hormone binding globulin, so we can have more free testosterone. Another important one is saw palmetto. It helps with the conversion from testosterone to DHT, helps minimize that conversion so we don't get so much of a buildup of DHT, which can cause hair loss. All right, now we talked about testosterone support. Let's talk a little bit about estrogen support because that balance of testosterone and estrogen is very important. So I want to make sure we're always keeping an eye on estrogen. So one very popular medication that you'll see is anastrozole. Right? If you prescribe testosterone, you've probably heard of anastrozole or prescribed anastrozole. It is an aromatase inhibitor. I always like to suggest that if you don't need it, if you can find other means of bringing down estrogen or balancing estrogen, then don't use it. But we do have the option available for you. So if you have patients who are very symptomatic to estrogen increases, then anastrozole may be a good option for them. I always like to recommend zinc and DIM, D-I-M, as replacements for anastrozole. Those can help balance out estrogen and testosterone and not let our estrogen get too high where we get symptomatic with it. The last one I want to talk about is I3C. It's often used for estrogen metabolism and prostate breast health. So these are different supplements. Anastrozole is not a supplement, that's a medication, but the bottom 3 are different supplements that we can use. So we want to give our patients a full toolkit of different products, different ingredients, whether it be herbs or minerals or medications to help with healthy testosterone levels. So staying on the topic of endogenous production, there's different ways we can influence this negative feedback loop. So if we influence anything upstream or increase anything upstream, it can influence anything downstream. So if we increase GnRH release, if we increase LH release, that can all cause an increase in testosterone in the testes. So if we want to increase the GnRH, the gonadotropin releasing hormone, we can use a medication called Gonadorelin. Gonadorelin is an analog of GnRH and stimulates the LH production. If we want to increase the amount of LH in the body, we can use what is called HCG. It's a hormone that mimics LH, increases the production of testosterone in the testes. So there's different ways that we can influence this negative feedback loop and increase testosterone production. So one quick note I wanted to add, and one reason why I'm very passionate about doing this men's health webinar, is I talked about before about my testosterone levels. So when I got my labs drawn last year as a 33-year-old male, I was in the low 300s, which is not great at all, not optimal by any means. I was at the stage where I wanted to maintain my fertility, and so TRT was not an option for me. I wanted to stay away from exogenous testosterone. So I decided to do rounds of Elevate T, of the Enclomiphene treatments. After the 5 months on Enclomiphene, my testosterone went from 363 as my baseline all the way up to 968. And my free testosterone, that's the one you really want to pay attention to, doubled from 14 to above 30. So this is just an idea of how well Enclomiphene can work. We can get a double, sometimes a triple fold of testosterone production, especially in those younger males. All right, we talked about different types of testosterone, endogenous versus endogenous, and I really briefly want to touch on monitoring testosterone. So as providers, it's very important that we understand how to monitor testosterone. So it's not just drawing free testosterone, total testosterone. We need to get a full picture of what their body is doing and make sure they're staying in a healthy range. So free testosterone tells the full story, right? That's the testosterone that the body can actually use. So if you have a patient who has high testosterone, but they also have high SHBG, they won't have a lot of free testosterone that the body can use. So we want to make sure that we're drawing labs to show an accurate picture of what's going on. It's important that we get LH, FSH numbers so we can determine the difference between primary or secondary hypogonadism. It's important that we draw estrogen levels. If estrogen gets too high, even on a SERM or on testosterone itself, then our patients can experience the side effects of estrogen, which can be water retention, which can be gynecomastia, mood swings. So we want to make sure that we keep that estrogen in a normal range. As we talked about before, the black box warning for stroke and heart attack was removed, but that does not mean that we shouldn't treat testosterone with the respect it deserves. So we always want to make sure that we're pulling our H&H, our hematocrit and hemoglobin, to make sure that our blood is healthy. For prostate health, TRT is not shown to cause prostate cancer in appropriately screened men, but because it can stimulate growth of existing prostate tumors and worsen BPH symptoms, products are contraindicated in known suspected prostate cancer. That's why it's important that we always draw and look at PSA and DRE on these individuals. One last slide here on testosterone. This is a supplement product that we have available through Strive. So if you want a more natural approach, if you don't want to touch medications, you don't want to touch exogenous testosterone, this is what is called our boost supplement. So this is just a mix of herbs and minerals to help, again, increase our endogenous testosterone production. So we have ingredients like Fadoja, we have Tangadali, we have Shilajit, we have zinc, and we have boron. We talked about zinc and boron and how the body needs those minerals to produce healthy testosterone levels, and how boron can help with the balance between total and free testosterone. But Fadoja is showing a lot of good studies in increasing LH numbers. Tangadali is showing that it may be favorable in testosterone to estrogen balance by supporting the aromatase enzyme activity. All right, key takeaways that I want to address going forward. We need to look at the big picture, right? We need to draw labs. We need to ask the questions, how they're feeling, how their confidence is, to figure out what's really going on with our patients. It's not TRT or nothing. We talked about endogenous versus exogenous. There's other options out there besides testosterone itself. Fertility must be discussed up front. That's going to be the big differentiator between using exogenous testosterone or improving our endogenous production. TRT does not necessarily turn you off forever. So if you started testosterone, if you have patients who've started testosterone and they want to get off of it, there's ways to do that. We can still influence that negative feedback loop with endogenous production. I want to reiterate my message about testosterone. I'm not saying that everybody needs testosterone. I'm saying that if your patients have low levels and their life is suffering because of it, they deserve an honest, evidence-based conversation about whether treatment may help. Shifting gears here a little bit, we're going to go away from hormones and we're going to talk a little bit more about healthy muscle. A lot of times we joke about the dad bod when we get older, when we have kids, when stress increases, when work gets busy. We may put on a few extra pounds. But I want to challenge that narrative a little bit. I don't want to use that as an excuse, but I want to use it as motivation, especially for our kids who are watching us and copying us. I want us to be able to show up and be present for them. Okay, we're going to get back into that negative feedback loop we talked about, but this is not with testosterone. This is with growth hormone. So if you've heard of Sermorelin, Sermorelin is a growth hormone releasing peptide. So it encourages the body, again, endogenously encourages the body to release more growth hormone. That can be beneficial for a number of different reasons, which we'll talk about here in just a second. What I want to point out here on this slide is these two sides of this graph. It's very important, the timing of Sermorelin when we're taking Sermorelin. It's important, make sure you understand that when you educate your patients on Sermorelin, that they are taking it at the end of the day, before bed, on an empty stomach. So you can see that ghrelin and also GH, IGF, they work synergistically. So if one's high, the other will be low. So we want to make sure we take Sermorelin on an empty stomach. So if your patients eat dinner at 6 p.m., make sure they don't eat anything for the next hour and a half, 2 hours before they take their Sermorelin and then go to bed. So just like with testosterone, we talked about endogenous versus exogenous. Same idea here. So if we're talking about Sermorelin, we're working with endogenous production. We're giving the body the tools. We're encouraging the body to release more growth hormone. If we're talking about exogenous, that's when we talk about HGH. That's where we're introducing growth hormone into the body. Two completely different cycles there. So a lot of times when we hear growth hormone releasing peptide, we get a little bit scared because we hear the word growth hormone. Just recognize this is endogenous production of growth hormone. So I want to talk about the benefits of Sermorelin, how it can be beneficial for your patients, for yourself. Sermorelin may support steadier energy. So if you have patients who suffer with brain fog, they feel like they're not thinking as clearly, Sermorelin could be a good option. It can help a lot with body composition, whether that be increasing muscle mass or increasing bone density. Both are very important, and Sermorelin can influence those pathways as well. The first benefit that most patients will see with Sermorelin is improved sleep. So if we increase our growth hormone while we're sleeping through the night, we usually get into a deeper sleep and we sleep a lot better. So these are just a few examples of how Sermorelin can help, but all are very beneficial for men's health in general. Just like any other medication or peptide, we want to talk about the warnings and the precautions with it. So Sermorelin should be avoided during pregnancy or breastfeeding. We simply don't have the data to support that it is 100% safe. Sermorelin should be avoided in patients who have a history of cancer, especially cancer with hormone-related tumors. If we're increasing growth hormone, we could also increase the growth of an active tumor. So we want to be very careful in those types of patients. We talked about that negative feedback loop, and so medication may not provide a benefit in patients with chronically high IGF-1. So if their IGF-1 is already high, trying to influence even higher will not work with Sermorelin. Okay, next one I want to talk about here is Oxandrolone, and I want to be very careful how we approach Oxandrolone. It is an anabolic steroid. There is legitimate clinical indications for it, which can include weight gain after surgery, trauma, chronic infection, offsetting protein catabolism, different things that Oxandrolone can be used for. But we do need to be careful with how we're using it if we are going to start prescribing in our practices. If you've heard of the brand name Oxandrin or Anavar, that's what Oxandrolone is. So it is an anabolic steroid. It's an oral anabolic steroid. We won't dive in too deep on Oxandrolone. I just want to make sure you understand that there is a purpose for it. There is a need for many patients that could benefit from it. Important things to know about Oxandrolone is that it is hepatotoxic, so it can cause damage to the liver, especially as an oral product. So make sure that you are watching liver enzymes when they're on this product. It can influence cholesterol levels, so make sure you keep an eye on those. And of course, it's going to suppress the testosterone production because it is an anabolic steroid. All right, shifting gears again, optimizing testosterone and muscle health naturally leads us to another critical aspect of men's health, which is sexual wellness. Oftentimes, it is not talked about enough, but erectile function, libido, and sexual satisfaction are not only quality of life concerns, but they're also markers of cardiovascular and hormone health. So let's dive in a little bit on products we have for sexual wellness. So it's not just erectile dysfunction in males. It can be libido, it can be stamina, it can be premature ejaculation, receptiveness, bonding with the partner. Different things can cause decrease in sexual wellness. We have a few different options for sexual wellness products, including Olympus, Tadalafil, Vast, different things that we'll talk about here in these next couple of slides. Olympus is probably our most common sexual wellness medication. It's a mix of 3 different ingredients, 3 different medications, which include bremelanotide, oxytocin, and you can do with or without the tadalafil. So with Olympus, we're not just attacking with blood flow, right, with Tadalafil. Tadalafil is an option. Tadalafil can help, but a lot of times it's related to our connection with our partner. So that is why we have the bremelanotide for our brain chemistry. We have the love hormone, oxytocin, just to help us connect a little bit better, to feel the intimacy a little bit better. This comes as a troche. So there's 4 or 5 different SKUs of oxytocin. You can find which is right for your patient, male or female. But these come as convenient flex dose tablets. So they're little tablets that are mint flavored. They'll take about 30 to 45 minutes before any kind of sexual activity. Of course, we're going to talk about Tadalafil, the weekender. So Tadalafil is that PDE5 inhibitor. It is a strong vasodilator, so it can help increase blood flow. We won't dive too deep on Tadalafil. Just recognize that we have 2 options available. Again, it's going to come in a convenient tablet. There's a 5 milligram and also 20 milligram. So you might have heard a lot of buzz about Tadalafil, daily Tadalafil being used for vasoactive benefits for increased blood flow. But we also have the 20 milligram for sexual wellness purposes. Okay, shifting gears one last time, we have brain and mitochondrial health. So far we've addressed hormones, we've addressed muscles, sexual wellness, but there's a common thread underlining all these, which is mitochondrial function. Mitochondria is in every cell, no matter where it's at in the body, so it's important that we have optimized mitochondria throughout our body. What we're going to talk about here is a very popular coenzyme. A lot of times it's grouped into peptide talks, but NAD is actually a coenzyme. So it helps the body produce ATP a little bit more efficiently. So if you think back to your days when you were in school, whether you're in PA school or NP school or wherever you went to school, you at one point learned the Krebs cycle. So if we can think back to the Krebs cycle, this is where NAD is going to do its work. So it works by accepting those electrons, those hydrogen electrons, and then it moves them down to the electron transport chain. So if we have deficient NAD, then the body can build up with oxidative stress, and it can manifest itself with brain fog, with lower energy throughout the day, with just lower cognitive function. So we want to make sure we have plenty of NAD so our ATP is being produced at a great rate. So that concludes our men's health webinar. I want to reiterate that men's health optimization is more than just hormone replacement. It's a complete rethinking of how we support vitality, longevity, and overall wellness. With the right tools, the right monitoring, and the right mindset, we can help our patients not just live longer, but live better, with better energy, better strength, better clarity, and confidence. This is precision medicine, and it starts with us. Thanks for joining this Strive session on men's health. If you're with us live, join us for the Q&A to get all your questions answered.